Okay, let's talk about that feeling. You know the one, that feeling of swallowing razor blades. It's become a really distinct and honestly pretty awful symptom for a lot of people. So in this explainer, we're going to break down absolutely everything you need to know to navigate COVID-19 right now in 2026. Oh, and hey, before we really get into it, if you're curious about how we even got here, how the virus has changed over time, you should totally check out our previous explainer on variant evolution. It'll give you some great background for everything we're about to talk about today. All right, so here's the plan for today. First, we're going to look at the virus itself, what's actually circulating in 2026. Then, we'll get into the new signs and symptoms, what to look out for. After that, we'll cover testing, when to do it, how to do it. Then, we'll talk about treatment, care, and recovery. We'll also spend some time on the lingering effects, long COVID. And finally, we'll wrap up with how to protect yourself and everyone around you. It's going to be a complete guide. Okay, let's get right into our first section. The virus is, well, it's always on the move, always changing. And right now, the main player on the scene is a variant nicknamed Nimbus. But it's not alone. The big takeaway here is that this thing is constantly evolving. So to really get a handle on the situation today, we need to know who's who in the variant world. So yeah, the one you've probably been hearing about is NB.1.8.1, or as most people are calling it, Nimbus. It's basically a descendant of Omicron, and it really popped onto our radar back in May of 2025. And since then, wow, it has just taken off, spreading incredibly fast all over Asia, Europe, and North America. Whoa, okay, look at this list. This is basically the genetic recipe that makes Nimbus, well, Nimbus. Each one of these little codes, G14D, N211I, and so on, is a specific tweak to its spike protein. Now don't worry, I'm not going to make you sit through me reading all of them, but the key thing to get here is that each one is a tiny change, a mutation. And it's this exact combination of changes that scientists are watching like hawks. Why? Because these little tweaks can change everything, how contagious it is, how it dodges our immune system, you name it. This is the nitty-gritty data they use to figure out what this variant is going to do next. And just to be clear, while Nimbus is definitely the star of the show right now, it's not a solo act. Think of it like a lineup. Scientists are keeping a close eye on a bunch of other variants that are also out there making the rounds. You've got LF7.2.1, MP.1, LP.8.1, BA.3.2, and XFG, just to name a few. All right, so we've talked about the genetic code. But what does all that sciencey stuff actually mean for you, for us? That brings us right to our second section, symptoms. What does an infection actually feel like these days? And here we are, full circle, back to what we talked about at the very beginning, that razor blades feeling. According to Atheneum Scientific Publishers, the standout symptom with Nimbus is, and I'm quoting here, a particularly severe sore throat, described by patients as feeling like razor blades. We're not just talking a little tickle in your throat here. This is a whole different level of pain, and it's become a major red flag for this variant. So let's walk through a typical timeline. What can you expect day by day? Okay, so days 1 and 2, that's when things usually kick off. You get that sore throat, a cough, maybe some congestion, a fever starts to creep in. Then you hit days 3 and 4. This is often the worst of it. Symptoms are at their peak, and that's when the serious fatigue and muscle aches really hit you hard. Now, for most people with a mild case, you'll start to turn a corner around days 5 to 7. Phew. And finally, from day 8 to 14, it's all about slow and steady recovery. But just a heads up, it's super common for that cough and tiredness to hang around for a while longer. With everything going around, it can be so hard to figure out what you're dealing with. Is it COVID, the flu, just a cold? This chart is super helpful for that. Let's look at some key differences. See onset? The flu and allergies just bam, hit you out of nowhere. But COVID and a cold tend to creep up on you more slowly. And a fever, that's a big one. Common with both COVID and the flu, but you almost never get one with a cold. And those really intense all-over body aches, that's classic flu for sure, but also pretty common with COVID. You're not going to get that with allergies. The real trick is to not just focus on one thing, but to look at all your symptoms together. Okay, so you're feeling sick, you've got some of these symptoms, and you're thinking, could this be it? Well, that leads us perfectly into our third section, testing. Let's get practical and talk about when you should test and how to do it properly, because trust me, there's more to it than you might think. Listen up, because this is probably one of the most important things to know about testing. Timing is everything. Seriously, if you test yourself on day 1 or 2, right after you think you got exposed, you are running a huge risk of a false negative. The test says you're fine, but you're not. And that's just because the virus needs time to build up in your system, to multiply enough for the test to even spot it.
If you can just wait until somewhere between days 3 and 7, your result is going to be way, way more reliable.
So is there a perfect day to test? A magic number? Well, yeah, kinda. Most experts agree that day 5 after you know you were exposed is the sweet spot. That's your best bet for an accurate result and for dodging that frustrating false negative.
All right, let's just quickly go over how to read these at-home tests, just to make sure we're all on the same page. Super simple. 1 line at the C for control, you're negative. 2 lines, one at C and one at T for test, that's a positive. And listen, even if that T line is super faint, it's still positive. Now, if you get a line at T but not at C, or no lines at all, that test is a dud. It's invalid. You got to toss it and use a new one.
So, that second line shows up, you're positive. What now? Well, that takes us to our 4th section, treatment, care, and recovery. Let's talk about what to do next to manage this thing safely and effectively.
The good news is, for most people, you can manage this completely fine right at home. It really comes down to the basics, but they work. Number 1, rest. Like actual rest. Your body needs it. Number 2, hydrate, hydrate, hydrate. Water's your best friend. If you're feeling really rough, maybe some electrolyte drinks can give you a boost. And number 3, for the aches and fevers, over-the-counter stuff like paracetamol or ibuprofen can really help take the edge off. But, and this is a big but, if you're pregnant, you need to steer clear of ibuprofen.
But what if you need a little more than just rest and water? For some people, there are other options. So the question becomes, could antiviral medicines be a good idea for you? These are powerful prescription drugs that can really lessen how sick you get, but they aren't for everyone. They're usually for people who are at a higher risk of getting seriously ill.
So who exactly is in this higher risk group? Let's go through the list carefully. It includes anyone aged 70 or over. It also includes people who are 50 and up, who also have other risk factors, things like obesity, diabetes, or heart, lung, liver, or kidney disease, or active cancer. Same thing for Aboriginal and Torres Strait Islander people who are 30 and over with those risk factors. The list also includes anyone who is moderately to severely immunocompromised, people with a significant or complex disability, pregnant women, and children with complex chronic conditions. Now, if you are in any of those categories and you test positive, the advice is clear. Call your doctor right away.
Okay, let's zero in on the advice for pregnancy for a second, because it's really specific and super important. So we already mentioned paracetamol is okay for symptoms, but definitely no ibuprofen. A big one is to pay very close attention to your baby's movements. You also want to keep drinking fluids and try to move around when you can to help prevent blood clots. And please, call your maternity care provider immediately if you notice any change in the baby's movements or if you have any bleeding, abdominal pain, or contractions. Don't wait.
You know, for a lot of people, just getting over the initial sickness isn't the end of the story. And that brings us to our 5th section, a really important one, long COVID. We need to understand what can happen in the aftermath of an infection.
The official medical name for it is post-COVID-19 condition, but pretty much everyone just calls it long COVID. And there are 2 really key words in that formal definition, chronic and systemic. Chronic means it's long-lasting. Systemic means it can affect your whole body, multiple parts at once. It's what happens when symptoms from your initial infection just never go away, or when totally new symptoms pop up weeks or even months later.
And what researchers are finding is that long COVID isn't usually just one symptom. It tends to show up in clusters of issues. The absolute number 1 most common symptom, a really deep crushing fatigue. And this isn't just being tired, it's a kind of exhaustion that sleep doesn't fix. Other common symptom groups include things like joint pain, cognitive problems, what people call brain fog, shortness of breath, and all sorts of neurologic issues.
And if you remember one thing about long COVID, please let it be this: anyone can get it. It doesn't matter if your initial infection felt like a bad flu or just a tiny sniffle. Even people who had 0 symptoms, absolutely none, can end up with this long-term chronic illness. Okay, after all that, let's finish on a proactive note. Let's talk about what we can actually do. This brings us to our final section, protecting yourself and others. These are the tried and true steps we can all take to cut down the risk of getting infected to begin with.
You know, the advice from major health organizations really hasn't changed that much because this stuff is proven to work. So what are the best ways to prevent infection? First, stay up to date on your vaccines and boosters. It's so important. Second, wear a good, well-fitting mask, especially when you're packed into crowded indoor places. Third, wash your hands. Soap and water, hand sanitizer, do it often. Fourth, think about airflow. Open a window, get some fresh air circulating indoors. And last but not least, and this one should be obvious, if you're sick, please stay home.
But what if you do test positive? how do you keep from spreading it to everyone in your house? Well, you want to isolate as much as possible. If you can, stay and sleep in your own room. If you have a second bathroom, use that one exclusively. Anytime you have to be in a shared space like the kitchen, wear a mask. Wash your hands like crazy. And be extra careful to stay away from anyone in your home who's in that high-risk group we talked about before.
And all of this really leads us to one big final question, doesn't it? This virus never stops changing. It's always adapting, which means so do we. As COVID-19 continues to evolve, we have to ask ourselves, how are our strategies going to evolve with it? How will our medicine, our public health policies, our personal choices, how will all of that change in the years ahead? There's no simple answer, of course, but it's something we are all going to figure out together.